Hello everyone, Michelle here today, and I am going to go over the 3 types of reconstructive surgery that we do here at Identical. To start off, the first one is probably one you guys are all familiar with, which is your classic denture that grandma or grandpa might have had. Our denture that we do here is something that you're going to take in and out, and I have a sample here to show you. This is of the lower. It's going to cover the whole lower, and it just is held in by glue. Retention can be great. That glue is used to help give you a good suction. Now, some of the downsides of the denture, which you may or may not be aware of, is that glue has to be worn. That glue has to be applied sometimes every day, multiple times a day, to help make sure it stays in place while you're eating. The denture needs to be what's called realigned or refitted every couple years when you have all the teeth removed. Because if you are having the teeth removed and not doing any implants, we do see bone loss. And when that bone loss happens, this denture isn't going to fit as well. So you may have to come in and see us for that realignment to get better fit. And every couple years, if the bone loss is significant enough, you would need to have a new denture made. Dentures over the hard palate can also be a bit uncomfortable for patients, unfortunately, because it's affecting the way your cheeks, lip, everything is fitted in the mouth, and it does take time to get used to. Dentures will also cover that hard palate and taste buds, so patients tend to find that while wearing a denture, you can't actually taste your foods as well. You miss out on full flavor. Dentures are still a great option. I don't want to downplay it, but it's definitely not the option we would recommend to patients. It's just there as what you can do if there isn't another option there for you. Our second option that we offer is a snap-in denture, which is very similar to the denture that I had just mentioned to you, but much better, because we will give you implants along with that. And as I had mentioned with the denture, our implants are going to help retain your bone so that you aren't losing muscle and bone, and your facial structure isn't going to be changing as much as it would with just the denture alone. Your snap-in denture with those implants is also going to be more retained, so you don't have to worry about using glue or it falling out when you're speaking, anything like that. The snap-in denture works a lot like a jacket snap would, where you pop it in and then it's going to stay all day and you take it out at night. That's it. Your snap-in denture is a more permanent option than the just denture alone. I call it kind of semi-permanent, versus the other option I'm going to go over with you, the screw routine, which is your final permanent. A lot of our patients tend to start with this snap-in denture, and we highly encourage you to do so. By getting those implants in there, it sets you up for life, so that down the road, if you do decide to upgrade from the snap-in denture to our screw retained option, you have the availability to do so. Our third option and final option is our screw retained implant bridge, which is my personal favorite because it's permanent. You do not have to worry about taking it in and out like you do these other 2 options. Denture, you're obviously using glue, and the snap-in denture, you have to take in and out every night. This screw retained is held in so that only the doctor will remove it for follow-ups when necessary. Because it's permanent, patients obviously love it much more because you're going to be speaking, talking everything naturally like you would your natural teeth. Your appointments are more limited with us. You only see us every 6 months to a year, and overall, it's just going to feel like your teeth again. You're going to feel like you have your smile back. Our screw retained implant bridge, because it's fitted over the gum, is much easier to take care of cleaning wise, which sets you up long term to have these for life. And finally, with this screw retained implant bridge, it's going to be much smaller than these other 2 options you see here, so the comfort level is going to be much higher for you. With these other 2, we do have to get a little bit of retention by making it a little bit wider, versus what you see here, it's more of this horseshoe shape. So as I had mentioned with the denture, not being able to taste your food like you may remember to, All of our patients with this screw-retained implant bridge option, your taste buds are open. Food is gonna taste how it used to taste. You are gonna feel like you are back to your old self. It's life-changing. I have some samples here of some of the screw-retained implant bridges we do here in office, because if you guys didn't know, we actually have our own lab here at Identical, where we make everything personalized for you. So some of these are gonna look really big, some of these are gonna look really small, some of them are gonna look white, and some of them are gonna look darker. And that's just because these are all options patients chose to make something fit their personal smile and make them feel like themselves. So just so you can take a look, these are just some samples of different sizes and shapes that we do here, and we're able to get to you in as little as those 2 to 3 days with your surgery time, where you'll be in these final screw-retained bridges and back to your normal life.